heart attack, you'll get some chest pain.
Right.
You get asthma, you get breathlessness. But blood pressure as such doesn't cause any symptom. That's why it goes unnoticed.
How does blood pressure become high for a regular, so to say, healthy looking person?
Hi, myself Dr. Prashant Pawar, consultant interventional cardiologist. Today we are at Making India Heart Strong, Expert Speak, and today we'll be speaking about hypertension.
Welcome to Expert Speak, Doctor. Thank you so much for giving us your time. And today we are asking a question which sounds very, very simple, but what do doctors mean when they say blood pressure?
Yeah. So in a layman term, if you see blood pressure, everyone gets afraid, But if you see the statistics also, almost 1/3, 30% of them, they have elevated blood pressure. So what do you mean by blood pressure? So it is a force exerted by the blood on the arteries. So whenever heart beats, there will be a blood flow, which will exert some pressure on the blood vessels. That is called as the blood pressure. So it will have two values. It will have the upper value where when the heart is beating, that time the force is exerted on the vessel. And in between the two beats, there will be a lower blood pressure. That's called as the diastolic blood pressure.
Doctor, we keep hearing, oh, my numbers are so high, or my number has dropped, my blood pressure feels low. What are the actual numbers that we should be looking at?
So after COVID, everyone is very much aware of all these numbers, saturation, blood pressure, sugars. Everyone is very conscious, So there are two numbers. One is the systolic blood pressure, and one is the other is the diastolic blood pressure. So systolic blood pressure is the upper value. Usually, if you see a normal blood pressure, it varies when the blood pressure upper value should be below 120. The lower value should be below 80. When any blood pressure, the upper value goes above 130, that is a hypertension. Lower value goes above 80, it's a hypertension. So two values are there. Upper value systolic blood pressure, lower value diastolic blood pressure.
Like, what are the most common causes of blood pressure in people?
Yeah. So the most common cause of hypertension is genetic. So mostly it runs in the family. Whenever our parents have blood pressure, almost 20-30% penetrance rate occurs in the next generation. So most commonly is a genetic, but it is not a single gene which affects it. It's a multiple gene related. Second common cause is renal, kidneys, because most of the time what happens in young patients, young hypertensives, the reason is kidney. Either the kidneys are having some disease called as a chronic kidney disease, either the blood vessels which supply kidney, they get narrowed down. Third, other hormonal changes, endocrine diseases like hyperthyroidism, Cushing's. So a lot of hormonal changes can also impair the blood pressure.
What happens sometimes, you go to a doctor and you realize that your blood pressure is high, but what are the most common symptoms that we should be looking out for? Like, okay, maybe it's time to head to a doctor's office now.
So blood pressure as such doesn't cause any symptoms. So you take any other, like heart attack, you'll get some chest pain.
Right.
You get asthma, you get breathlessness. But blood pressure as such doesn't cause any symptom. That's why it goes unnoticed. That's why blood pressure is called as the silent killer. You get symptoms only when the complication starts. What complications can occur? Right from head to toe. It can cause stroke. It can cause dissection of the vessels, aortic dissection. It can cause bleed in the brain. It can cause heart attacks. And it can cause kidney problems. Sometimes bleeding can occur even in the eyes, retinal bleeds, conjunctival hemorrhages. So most commonly what we have seen is people come with headache. They get bilateral frontal headache. Usually occurs in the morning hours. So early morning headaches, both sides. Sometimes they come with breathlessness. So these are the common symptoms, but mostly it's a silent killer.
Right.
Most of patients who come to us for health checkups, their pressure is elevated. Mostly the IT guys and all, they come for a routine checkup. They don't have any symptoms. The pressures are 170, 180.
So in that case, doctor, what would you suggest people should do to avoid it? Since it's such a silent killer, you don't even know what the symptoms are half of the time. You get to know only when, I would say, the damage is done. So if you had to tell us, okay, maybe get started with this, take these 3 steps as precaution, what would they be?
First is identification. One is yearly checkup is very important. Even though if you don't have any symptoms, you should get a yearly checkup done. Nowadays, everything is, we can check everything at home, In COVID time, from doctor consultation, from oxygen, everything we have gadgets in the home. So home blood pressure monitoring is a very important tool.
Right.
Get a good quality machine, electronic BP apparatus, and frequent blood pressure monitorings, at least maybe in 6 months or 3 months, if you have symptoms, should be done. And a yearly health checkup is required to rule out or to identify things early.
When you have all these gadgets at home, people tend to overanalyze also, and they tend to get into panic mode. Where do you draw the line as a doctor when you suggest somebody, okay, you need to keep a check on things? How does one keep that check in check also at home? Like, if you can just share your thoughts on that.
See, I do understand that nowadays everyone is very anxious. There is a lot of panic happening. I get many patients who come, the doctor by a smartwatch showed a heart rate of 150. My blood pressure shoot to 170. But those are false alarms most of the time. It depends upon what gadget you are taking, what gadget you are using for checking the blood pressure, how you are checking the blood pressure. Very important, Ideally, blood pressure, what we doctors check in our clinics is we don't check the blood pressure directly when patient walks into a clinic. That may be elevated. That's called as a white coat hypertension. Same way, you should allow the patient to rest for 5 minutes. The bladder should not be full. You should not have a strong coffee or cigarette or smoke before that. First reading should be neglected. Average of second and third reading should be taken.
Right.
These are the ways how we measure the blood pressure. So most of them, what happen? Patient himself connects the blood pressure. He is watching on the electronic gadget. The pressures always will be on a higher side. Then he gets panicked and he rushes to the hospital. So a right way of monitoring blood pressure, the teaching how to check a blood pressure is very important, what I feel. Because most of the time, it's a false alarm.
I think that's very useful because in today's day and age, we tend to be very, very dependent on our gadgets, but we need to understand how to read these gadgets also. So thank you for sharing that. So we are now going to talk about what to do if you're already somebody with blood pressure. And then I also want to understand from you, can it really be reversed? Is it something that can, with a good lifestyle change, be reversed in like the longer term?
There are a lot of hypes coming off reversal programs, right? From reversal of aging, reversal of diabetes. Everyone is now hyping about reversal of blood pressure. But it's really myth. You can't reverse your hypertension. You have to live with it. You can't cure it. You have to maintain it. So the ways of maintaining, one, we have to find out the risk, why it happened first of all.
Right.
So it can be a primary hypertension. It can be a secondary hypertension. Secondary means there is some cause, either kidneys, either thyroid, either endocrine. So if you treat the cause, you can control it in a better way. To maintain the blood pressure is targeting those risk factors, what can cause it. Like weight reduction, even a 5 to 10% weight loss can significantly control your blood pressure. But you can't be away from the medicines, but it can be maintained in a better way.
Right.
Avoiding those addictions, following a regular diet, and continuing regular compliance with the medicines. Those are required to maintain a normal blood pressure.
While we're talking about that, I also want to understand, why does it happen in the first place? How does blood pressure become high for a regular, so to say, healthy looking person? And even if it's not a healthy looking person, what are the causes?
So if you see, there is always a panic when someone is diagnosed with blood pressure or hypertension. But if you see the Indian data also, our Indian data also says that almost 33% is the prevalence rate of blood pressure. That means every third person is having a blood pressure. Suppose there are people standing in line, every third person will have a hypertension. So that high is the number. Why? First, lifestyle. Main is sedentary lifestyle, lack of physical activities, overweight, and the food habits. We Indians, we have a lot of salt,
Right.
So direct salt consumption is also high. Indirect salt consumptions are very high. If you see our diet, mostly papad, pickles, pani puris, bakery products, farsan, sev. So all are rich with salt.
Right.
Wherever sodium will go, water will go. Wherever sodium will go, pressures will be elevated. So main consumption of salt should be curtailed. It should be low as possible.
So, doctor, if I have to ask you, if I have to make a change in my kitchen, and I'm talking about in general Indian kitchen, the regular Indian kitchen, like what are the 3, 4 things in addition to bringing salt down that you would say, okay, this is a good start for you?
Yeah. So one is ways of preparing food. They are also important, because see, we can't change our taste buds. We are used to with that salty taste. So we should know how to reduce your salt and introduce some other things instead of that, like adding some tamarind or lemon to make the same sort of taste, or using something like a low sodium salt available. Nowadays, we get low salt, low sodium salt.
Right.
So in those salts, or what our grandfathers used to have, those pink salt or Himalayan salt, rock salt, they have a lot of potassium and less of sodium. So if you reduce your sodium content even by 7 to 8 millimoles, the low sodium will have 7, 8 millimoles less sodium as compared to the normal salt. Even that can benefit.
So, doctor, a lot of people have a lot of apprehensions when it comes to blood pressure medications. I want to understand from you, how do these medicines actually work? When you're taking a blood pressure pill, what happens to your body?
So, antihypertensives, what are the blood pressure medicines? They act on multiple molecular levels. They act on some channels.
Right.
Like the first thing is diuretic, that is a water pill.
Right.
The long-acting diuretics we give so that the excess of water and salt is excreted. Second type is ACE inhibitors or angiotensin receptor blocker. So this molecules will act on different pathways in total to reduce certain hormones or certain chemicals which is rising your blood pressures.
Right.
Some molecule like beta blocker will act on your sympathetic nervous system. So in our body, there are two systems, like sympathetic, which is like your accelerator of your car. It will increase your pulse rate, blood pressure.
Okay.
They'll act as a brake, like parasympathetic. So certain medicines you have to give to act on different pathways so as to control it.
Okay. So I also want to understand now, because what happens, people take a pill, they feel good, and they decide, okay, now I don't need this medicine. Or what happens in a lot of cases, they just feel that maybe I should take an additional dosage and it will make me feel better. So why is it important to stick to that particular dosage when it comes to blood pressure medication specifically?
So it happens quite in our society, they feel that it's like a fever medicine. You take a crocin tablet, your fever goes, you stop it. So most of them, they feel that they take the blood pressure medicine, BP is controlled, now let's stop it and see. But see, that effect of blood pressure medicine is giving that control of blood pressure. So the effect will last for 12 hours or sometimes 24 hours. Beyond that, your pressures again will be shoot up. So most of the time, they come with a overshoot of blood pressure. They stop the medications and suddenly there is a sudden rise in blood pressure. That creates more problem. So compliance of medicine is very important. Whenever a patient comes to us, as a doctor, we don't directly jump on medications. We spend some time, lifestyle, we spend some time, diet. Third is compliance of medicines.
Sir, do you think people fear that they'll become too dependent on it and they'll never get off medication? Is that something that plays in their mind?
Nowadays, maybe because of social medias and a lot of alternative medications or alternative therapies, they have come up with some programs or reversal and all. People are a bit afraid of medications. The main fear is that, doctor, I have the BP medicine, my kidneys will get fired. I tell them the opposite way. If you don't take it, your kidneys will get fired, There is always a fear that once BP medicine is started, it will be lifelong. I tell them, but because of that, you will live lifelong. So there are ways of convincing them. There are ways of expressing them. But it's not the fact, that sometimes if you control the risk factors like obesity, if you control your weight, maybe the dose of medications will come down. Maybe the pill burden will come down. It may not stop, but the number of medications and dosages will definitely come down.
We need to also ask you one more question. A lot of people think medication, exercise, everything will just fix it. Fix being the word. how do you think it's a lifelong management issue and not something that can be fixed with these
Yeah.
little programs that we introduce in our life?
See, this blood pressure, I told you, we can't reverse it, we can't cure it, we can maintain it, but it will have effect on all systems. It's related to brain, it can cause strokes, it can affect your heart. People come with heart failures because the heart gets dilated or the muscles become thick. They come with heart failures, can cause dissections, heart attacks. It also causes peripheral nerve problems, neuropathies, and kidney problems. So it's not a one-time go that you take this medicines, take it for a month or 2 months, and then everything is stopped. It can be controlled by all this other things like weight loss, diet, exercise. It can be reduced. You have to go together hand in hand. So all these things will go, but medicines also are required to maintain it. If you, it's like I consider it like a farmer put some seeds in it, and then after a year or 2 years, it takes that fruit out, so same way, if you maintain your blood pressures now, after 5 years, 10 years, those complications will be avoided. Blood pressure doesn't cause complications immediate. You don't have a complication 6 months a year. You get problems after 5 years, 10 years. So if you control your blood pressures, they're like SIPs. If you invest slowly now, the fruits are taken later. So if you control your blood pressures now, the benefits are seen later.
I think it's great advice that think of it as an investment for your future right now. Like take those small steps.
Yeah.
Thank you so much for sharing all of this
Thank
with
you.
us. It's been wonderful chatting with you.